COVID-19, it's something that we've all been talking about, something we've all been learning about because it's this new pandemic. It's something that has stopped schools, has stopped major sporting events like the NBA, the MLB, major soccer leagues around the world. It's even postponed the Olympics. Some people are confined to their homes. They're stuck in their homes because this can harm them. I have a little sister who has a weak immune system that this could hurt her. So it's hard for us to leave our home as well. Health authorities are telling us to stay home if we can to prevent the spread of the virus. But can this really help? Can this really help us to stop the virus? Before I get into that, I want to teach you guys one thing. What exactly is COVID-19? Oh, there we go. So on March 24th, 2020, the FDA posted this on their website about the virus. Coronavirus disease 2019, or COVID-19, is a respiratory illness that can be spread from person to person. COVID-19 is a novel or new coronavirus that has not been previously seen in humans. So, coronavirus is a type of respiratory illness. So, it's comparable to the flu and to the common cold. Those are the most common respiratory illnesses we know. And the term coronavirus is just a general term for a virus that's like it. So this is just a newer coronavirus. So who is most at risk for this? Everybody's at risk. Everybody's at risk to get this virus. Just some people are higher risk to getting it more severe. On March 11, 2020, the WHO, or the World Health Organization, said this. However, evidence to date suggests that two groups of people are at higher risk of getting severe COVID-19 disease. These are older people and those with underlying medical conditions. So yes, we're all at high risk of getting this. Some of us are at higher risk of getting a more severe case of this. That is older people and people with medical conditions. So that's what COVID-19 really is in a nutshell. So how can we really prevent this COVID-19? Well, health authorities have been telling us to do two things. And I'll start with the first one, which is good hygiene. So good hygiene is simple. It's washing your hands. The CDC on March 18th, 2020 said to wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. Simple. We've all been taught this our whole lives. We've all been taught to wash our hands, not touch our face. It's just simple hygiene. The second one is social distancing. But what is social distancing? So what we've been told, social distancing is staying 6 feet apart from each other and staying home if you can. We have some essential workers that have to go out to work, but they are keeping 6 feet away from per people they are working with. How will this help? How will social distancing help? Roy M. Anderson said in an article, this is a really long title, how will country-based mitigation measures influence course of the COVID-19 epidemic? On March 21st, 2020 is when the name of that article, or when this article was made. So before I quote it, I want to tell you what mitigation means. That means to reduce. And Roy Anderson said, voluntarily social distancing by individuals and communities will have an impact and mitigation or reducing efforts, such as measures put in place in China, greatly reduce transmission. So when we social distance, we reduce that chance of spreading the virus. We reduce that chance of giving it to others. Some people don't even know that they have it. They don't show symptoms. A good example of this is Donovan Mitchell. He didn't have any symptoms, but yet he was tested positive for the coronavirus. Now that we have these two things that we can prevent it with, is canceling all these major events and canceling school a good idea? Yes. Canceling these things is good. On March 13, 2020, Governor Gary Herbert and Dr. Kurt Hegman spoke to the public about public schools in Utah. And Carter Williams of KSL reported on this speech, and he stated Dr. Hegman pointed to Japan's reaction of issuing closures and recommending social distancing at an early stage as an example of what to do. So Japan started their social distancing early, and Dr. Hegman showed a graph similar to this graph, showing what Japan did. So this graph is the confirmed cases. We're right here. This is the U.S. right here. This purple line. This is China right here, and right here is Japan. Japan's line is flattening out a lot faster than ours. That's because they practice social distancing early. They started practicing those things early to prevent it from spreading faster. China did the same thing, and theirs is leveled out. If you notice, we're higher than Italy. And if we practice this social distancing, this can help us. So this is frustrating, not having to be able to go to school, have sporting events, or be able to meet with our friends for some of us. It's very frustrating. I think it's frustrating. But I know if we practice these things that the CDC, the government has told us to do, we can prevent this virus from spreading any further. This is a way we can flatten that curve, like I showed on that graph. And I know that as we do this, we can prevent the coronavirus by social distancing and having good hygiene. Is there any questions about preventing the coronavirus?
What is your opinion regarding the CDC's new policy about wearing masks when going out in public?
So regarding the CDC's new policy, so there's not a set in stone policy. Right now it's just a recommendation, but the masks will help. It's better than nothing, because you can still get the virus through your eyes and through your ears, but that mask gives it a less likely chance of you contracting it. Did that answer your question?
Yeah, and I have another. Do you think there's anything else that should be done and isn't currently being done to help further prevent the spread?
I think everything is being done. Everything's in place that we need to, like the social distancing, staying home, the masks, everything's supposed to be done. It's just we have to do our part to make it happen. A lot of people are doing it, but there's also a lot of people that are not following it. So if we do our part, that will help us.
Okay, thank you.